My name's Sam Harvey. I'm a psychiatrist and I work at the Black Dog Institute in Sydney. I get referred a variety of patients who are suffering from problems with their mood, such as depression, or with anxiety, or sometimes patients who have post-traumatic stress disorder.
My name is Craig Semple. I'm a former police detective in the New South Wales Police Force. 25-year career I had in the police force. I was medically retired about 6 years ago as a result of post-traumatic stress disorder and also major depressive disorder.
All of the patients that are referred to a psychiatrist, such as myself, the referral has to come from the GP. Sometimes psychiatrists may ask you to fill out some questionnaires before your first appointment. They might be online questionnaires or paper questionnaires. That is just to help the psychiatrist understand the type of issues that you're likely to want to be discussing, and sometimes also to help you think about what is most important for you. From a more practical point of view, gathering the names of medications you've been on before or the boxes of medications you're currently on, previous reports, that type of background information can really help with the first assessment. When you see a psychiatrist for the first time, one of the things that psychiatrist will be trying to determine is what your diagnosis is. Now, a diagnosis is just a description of your symptoms, but it's important because it helps guide what treatment is likely to work. Very often, what you and that psychiatrist are doing together will only be one part of what you're doing as part of your recovery. Your GP will be involved and they will be helping manage both your mental health problems but also any physical health problems. But increasingly we also try and have a range of other people involved as part of the team treating your symptoms. And also if you're someone who's at work or who your work has been affected by your illness, we'll often be working together with your case manager, with your occupational rehabilitation provider, your return to work team, to make sure that we're all moving in the same direction. When you see a psychiatrist, you should expect to be getting better. But I think it's reasonable to think about what getting better is likely to look like or feel like. Mental illness, be it depression or anxiety or post-traumatic stress disorder, doesn't tend to disappear overnight. It will be a gradual process.
And for most of the side effects that I experienced, like sexual loss of libido, sexual dysfunction, putting on weight, increasing cholesterol, all those sorts of things, it was all working out the risk-benefit type analysis.
If you find you're on a medication that causes you to have side effects, there's really three options that you will be able to discuss with your psychiatrist. One option is if the side effects are not too problematic and the medicine's having benefit, then you carry on taking it for a period of time. The second option is you try, that together with your psychiatrist, you try and find an alternate medication that doesn't have those side effects. The third option is that there are some side effects that we can try and reduce with another medication. That's normally the least favoured of the three options, just because in general most psychiatrists will want you to be on as fewer medications as possible, as most patients will want.
Usually leaving an appointment I would feel a sense of relief.
My top 4 tips for recovery are, firstly, to find a clinician that you trust and that is able to give you best quality evidence-based treatments for your symptoms. The second thing is for you and your clinician to agree a set of realistic treatment goals. There's no point you and your clinician just meeting regularly and not working towards clear things that you want to achieve. The third thing is it's very unlikely that there's going to be one magic treatment that gets you better. It is likely that you're going to need a combination of things. Medication, talking therapy, exercise, it'll differ for each person, but if you can focus on the fact you're going to need lots of different things and bring them together, then that will help in your recovery. Lastly, you have to get the right support team around you as part of that. part of that support team will be your psychiatrist and your psychologist, but there will be other people like your case manager and your GP who need to be involved, and also people that are important to you in terms of supporting you in your life, your family, your friends and other people. And having that team around you is crucial for your recovery.